Well, my name is Mohammad. I'm the founder, CEO of Home Health, a newly established home health company in Saudi Arabia. We also collaborated with our colleagues and partners, Buurtzorg from Holland, whom they have a very innovative, forward-thinking model of providing home health care services in Holland and elsewhere in the globe. We are pleased to also present them or introduce them to Saudi market via the global health.
My name is Thijs de Blok. I'm the CEO of Buurtzorg International, and as Mohammad said, I'm from the Netherlands. We have an organization of 15,000 nurses in the Netherlands without any managers. And it's quite a radical way of thinking, and this is also why we called Mr. Sager's attention. And quite a lot of people, they react surprised or confused to this way of working. We've seen in a lot of countries in the world that a self-managed way of working has the future. It's the demand of the younger workforce, and it's a lot more cost efficient, and that's also why we'd like to showcase it here at the health exhibition. So the nurses in the Netherlands and in other places, they work in teams up to 12 people per team, and they are in charge of the entire process. So the care process, but also the hiring and firing of colleagues, the recruitment, the planning, the financial administration. And they all do this in a team effort. So connecting to their nursing activities, which is community nursing, healthcare activities in the home of the client. They also become the owner of a small enterprise. And for this you need an entrepreneurial way of thinking, and we see that the entrepreneurial way of thinking affects the healthcare in a positive way, and the healthcare affects the entrepreneurial way of thinking in a positive way. So it's a win-win situation.
And for us what attracted us is the scalability of the model. We thought this model fits the needs of Saudi Arabia. It's a large country with also growing population. So the scalability of it, the outreach of it remotely, this model guarantees that in a cost-effective way, also satisfactory to the staff and the nurses, reaching all where it's needed, the service needed of the patient where it's needed. Usually this is not the case. We're struggling in the home care services. So we believe the model gives us the scalability, the outreach, and providing the needed service by the patient, not just any service, for the right patient at wherever he's located. So we're excited to present Buurtzorg Model here. We're proud and honored to have partnership with them, and we're looking forward also to growing, maybe starting here in small steps, but growing to encompass the entire population of the Saudi Arabian and the regions. The market is growing, it's encouraging. The transformation program launched 2017 is also giving opportunities and initiatives. However, we face challenges in the costing, in the budgeting of it, and also reaching the most needed patients. Usually, most services are concentrated in the major city, Riyadh, Jeddah, and Dammam and elsewhere. But also we haven't reached other areas where it's less served, underserved. I think the model, that's why we believe when we researched it, we believe that Buurtzorg Model is the right model to move forward, to provide the quality service where it's needed and when it's most needed by the patients. So it's growing, and I think will help. Buurtzorg will help Saudi Arabia healthcare system, provide better quality of life for the people of Saudi Arabia.
Yeah, and if you look at Western Europe, how it's developed in the past decades, it's sort of a time machine how Saudi Arabia will look in a couple of decades. So we deal with the aging populations. Organizations in Western Europe, they made it sort of a habit to provide an abundance of services, to provide too many services to people that need healthcare in this way that it's not sustainable anymore. So if we would want to provide healthcare in Western Europe, as a lot of organizations are doing now, 1 in 5 people will need to be a healthcare professional, but this is not realistic. So people are looking for a model that's more efficient in dealing in a way that's modular, scalable. As Mohammad said, it's also applicable everywhere, because the ideas and the vision on what does good healthcare mean, and what does your home situation mean, they're universal, they're the same everywhere. And we've learned a lot in the past 10 years of our international projects, and I think it can also be a good outcome for success here in Saudi Arabia.
And one of the most advantages of the Buurtzorg model, you know, the challenges, you ask about the challenges that we face here is the staffing, the nurses. We have, you know, no matter how many nurses you have, it's still limited. So the challenges here is related to the staffing, and the model, the Buurtzorg model, guarantees almost satisfied nurses and staff. Also, one of the key benefits here is incorporating the informal care. We needed to incorporate the informal care with the formal care to make sure that we provide the services based on the needs of the patients. So sometimes you needed formal care, which you have limited resources, but also in many cases you will have to use informal care within the community, within the neighborhood, within the relatives of the patients.
It's the informal caregivers, and we see this also in Holland a lot. They mean to do really well, but they're often not people with a medical background. And if you're not medically trained and you are wanting to do the right thing, doesn't mean you always automatically do the right thing. So if you as a nurse have the freedom and time to also instruct the family members or the informal networks on how to deal with this, you can be a lot more efficient. So it's home healthcare is a lot more than just providing a service over and over and over again, but it's actually a social structure that you need to think in. And it will be challenging because the culture in the Netherlands is a little different than here in Saudi Arabia, and also the culture around healthcare. But it's looking at the context and finding solutions that fit in the context.
And even amongst the MOH and the other government, they are now shifting more of the services, care from the institutions, hospitals, to the home-based services. And for that to be addressed, I think we need best practices. How like Buurtzorg in Holland and elsewhere have addressed these issues, and we're just getting these best practices. One would hope that this will provide us to enlarge the area of coverage and go to the most needed people for the service. And we're really excited with the Buurtzorg and Thijs, and also we appreciate Informa and the Global Health exhibition that gives us this opportunity to promote this model.